And you mentioned that you worked in critical care. What was that like?
Working in critical care is every day. It's just highly strong emotionally, physically. Every day you're just really tired and exhausted because you're on your feet almost 12 hours. Like last night, I had two critically ill patients, and it's just nonstop. You go here, you go there again, you go here, you go. I mean, it's just nonstop and emotionally draining at times because a lot of them are, on their end of life, or a lot of them just experience the most devastating thing that would happen. So, and they're still not comprehending why it happened, or the family is not comprehending why it happened. So it's emotionally draining, sometimes working in critical care, and especially with this COVID situation where family members are not allowed, or there is a limitation. Like in our hospital, if you're non-COVID, luckily we still allow one family member to stay with the patient, but there should be there for 24 hours. It cannot change. Like, it's one person, but it should be the same person for 24 hours. So at our hospital did that because they saw that, the patients obviously still needs the emotional support. And but then that leads to a bigger problem, because then some family demands, why can't he come, why can't this come, why can't so every day, literally every day, we deal with family demanding to have at least 3 to 5. The other day there was 10 people who were out in the lobby waiting to just arguing with our guest services. So it's a challenge working in critical care, and we understand why they want to be there, except that this COVID situation doesn't permit that. And because non-COVID times, we allow we didn't have a limit. Our hospital is one of the rare ones that's open 24 hours, no limitations, because we value family to be part of the healing process.
That sounds like a very difficult situation. How else has COVID affected your nursing practice or how you take care of your patient, your interactions with patients and family members?
With COVID, I feel like it's there's kind of like a it's harder to deal with family because of that visitation part, which is kind of in a way easy to deal with. But the problem is when you deal with the patients with COVID, it's I know they're really, really afraid because they've heard all this news of people dying and all that. And they're already short of breath, so it's really hard dealing with them because also you can see if they're not gonna do good. You know in your heart that they will or will not do good. So it's emotionally draining and physically draining as well, because you have to wear the whole PPE the whole time you're in the room. Our unit actually is a neuro ICU. We don't deal with, we have a separate COVID ICU, but a lot of our initial admissions are possible COVID. And we've accepted COVID patients and then we transfer it. But yet, when you admit, you're in the room for almost an hour to 2 hours straight with all your PPE, and by the time you're done, your s- your your uniform is already wet because it's so hot. It's hard to breathe, and and I mean that's one thing that's really hard when you're dealing with COVID patients is your PPE, wearing the PPE for at least a good 1 hour, especially in critical care.